Tired of frequent nighttime bathroom trips disrupting your sleep? If you're living with diabetes, Nocturia may be an unwelcome nightly visitor. But don't worry, there are simple steps you can take before bed to help manage this issue and enjoy a restful night. Discover the essential bedtime habits that can lead to more peaceful slumbers and improved health. Top 5 things diabetics should do before bed to avoid nocturia. Number 1, manage fluid intake strategically. All right, let's dive into our first point. Understanding how and when you consume liquids and also what types of beverages you choose can play a really big part in managing nighttime urination. You see, thoughtful fluid management is a key way to reduce nocturia if you have diabetes, and this can lead to better sleep and improved daily well-being. Timing your liquids. Now, when we talk about managing fluids, one of the most direct ways to cut down on those nighttime bathroom trips is to be careful about your fluid intake, especially in the hours right before bed. If you restrict liquids for a few hours before you sleep, it gives your body plenty of time to process them. This means your bladder is less likely to get full and wake you up during the night. Of course, this doesn't mean you should let yourself get dehydrated. It's really all about smart timing. It's so important to stay properly hydrated throughout the day. Try to drink most of your fluids in the morning and afternoon. This way, your body's hydration needs are met, but you're not overloading your system at night. Keep in mind that dehydration can make your urine more concentrated, which might irritate your bladder, and it can also negatively affect your blood sugar levels. So, aiming for consistent hydration earlier in the day is a good strategy. As a general rule of thumb, think about stopping most of what you drink about 2 to 3 hours before you plan to hit the hay. This window can be different for everyone, depending on individual factors, so you might need to play around with it a bit to see what works best for you. The key is to listen to your body and adjust this time frame as you need to, always making sure your overall health and hydration are the top priority. Choose diabetes-friendly beverages. Next, let's consider the types of drinks you're having. What you drink is just as important as when you drink it, especially when you're managing diabetes and trying to reduce nocturia. Drinks that are high in sugar or caffeine can actually make both blood glucose problems and bladder activity worse, which means more trips to the bathroom. So, choosing diabetes-friendly options can help keep your blood sugar levels stable and might also reduce bladder irritation. Water really should be your go-to drink. It has no calories, no sugar, and no artificial sweeteners, so it's perfect for staying hydrated without affecting your blood glucose. If plain water doesn't sound too exciting, you could try infusing it with natural flavors like cucumber, lemon, or berries for a nice, refreshing change. And besides water, some herbal teas like chamomile or peppermint can be quite soothing. They're usually caffeine-free, so they can be good choices for the evening. Unsweetened almond milk or other nut milks can also be okay in moderation. It's a good idea to steer clear of sugary sodas, fruit juices with added sugar, alcoholic drinks, and caffeinated beverages like coffee or black tea, particularly in the evening. All of these can lead to increased urination and can really mess with your sleep. Number 2, monitor and control blood glucose levels. Moving on to our second key point, monitoring and controlling your blood glucose levels. This is absolutely fundamental for managing diabetes, and as a result, for managing nocturia too, especially in the evening. You see, high blood sugar has a direct effect on your body that increases urine production. That's why keeping a close watch on your glucose and controlling it well is a really important strategy for getting more restful nights. The hyperglycemia-nocturia connection. So, let's talk about how high blood sugar and nighttime urination are connected. When your blood glucose levels are high, this is called hyperglycemia, your kidneys have to work extra hard to filter out all that excess sugar from your blood. This process is known as osmotic diuresis. It happens because glucose molecules actually pull water with them as they're passed into your urine. As a result, the amount of urine your body produces goes up quite a bit, and that leads to more frequent urges to go to the bathroom. Now, if your blood sugar is high before you head to bed, or if it stays high throughout the night, this effect of increased urine production will continue, and that directly contributes to nocturia. Your kidneys will keep making larger amounts of urine as they try to get rid of that extra glucose, and this will interrupt your sleep with multiple trips to the restroom. Understanding this link really shows why managing your blood sugar effectively is so important. Evening blood sugar management. So, what can you do about it? Well, getting into a consistent routine of testing your blood glucose before bed is a really essential step. When you check your sugar levels before you sleep, it gives you valuable information. You can see how your meals, your activities, and your medications are affecting your glucose control in the evening. This knowledge then allows you and your healthcare provider to make smart adjustments to your diabetes management plan. Now, while the ideal blood sugar targets can be different for everyone, general guidelines often suggest aiming for an evening blood sugar level that isn't too high, so it doesn't trigger that increased urine production, but also not so low that you risk having low blood sugar during the night, which is called nocturnal hypoglycemia. It's really important to talk about the best pre-bedtime glucose targets with your doctor or diabetes educator. They can give you personalized recommendations based on your overall health, your treatment plan, and your specific needs. There are several strategies that can help keep your nighttime glucose levels stable. Eating a balanced evening meal that includes fiber, protein, and healthy fats can help your body absorb glucose more slowly. If you tend to have low blood sugar overnight, your healthcare provider might recommend a small, suitable bedtime snack that contains complex carbohydrates and protein. On the other hand, try to avoid heavy meals or sugary foods and drinks close to bedtime, as these can cause unwanted spikes in your blood glucose. And remember, being consistent with your meal timing and sticking to your prescribed medication schedule are also really vital for stable nighttime readings. Number 3, time medications appropriately. Let's move on to our third tip, timing your medications appropriately. The timing and the type of medications you take, whether they're for diabetes or for other conditions, can really influence how often you need to urinate at night. That's why working closely with your healthcare provider to get your medication schedule just right is a crucial step in managing nocturia effectively. Diuretic medication timing. First, let's talk about diuretic medications. These are often called water pills, and they're commonly prescribed for conditions like high blood pressure or swelling, also known as edema. How do they work? Well, these medications encourage your kidneys to get rid of more sodium and water from your body, and this, in turn, increases urine production. Now, while they're helpful for what they're prescribed for, their timing can really make a big difference to your nighttime bladder activity. So, if you're prescribed a diuretic, it's a good idea to discuss the best timing with your doctor. Generally, it's recommended to take diuretic medication earlier in the day. For example, you might take it in the morning. Or, if you take it twice a day, The second dose should ideally be no later than early to mid-afternoon. Scheduling it this way allows the main effect of the medication to happen while you're awake, which reduces the chance that you'll be up multiple times during the night to use the restroom. Diabetes medication management. Now, what about diabetes medications? Well, certain diabetes medications can also affect how often you urinate. For instance, there's a class of drugs called SGLT2 inhibitors. These drugs work by lowering blood glucose because they cause the kidneys to remove sugar from your body through your urine. And while they're effective for controlling blood sugar, and they even offer heart benefits, the way they work naturally increases both the volume and frequency of urination. This, of course, can contribute to nocturia. Other diabetes medications might have different, less direct effects, or they could interact with other medications you're taking. So, it's really important to understand how your specific diabetes drug plan might be influencing your nighttime bathroom visits. If you think your medications might be contributing to your nocturia, it's essential to talk this over with your healthcare provider. And this is very important. Never adjust the dosage or timing of any medication on your own. This includes diuretics or your diabetes drugs. Your doctor is the one who can review your complete medication list, figure out the potential impact on nocturia, and then decide if any changes, like adjusting the timing or even trying a different medication, are appropriate and safe for your overall diabetes management and your health. Number 4, implement physical strategies. Okay, let's look at our fourth strategy, which involves implementing some physical techniques. Beyond making changes to your diet and medications, certain physical approaches can help manage fluid buildup in your body. This could potentially reduce the amount of urine your kidneys produce overnight. These strategies are all about using gravity and gentle pressure to help redistribute fluid before you go to bed. Elevate legs to reduce edema. One such technique is elevating your legs to reduce swelling, or edema. If you notice swelling in your legs or ankles, elevating your legs for a little while before bedtime can be a simple but effective thing to do. What this involves is lying down and raising your legs so they're above the level of your heart. You can do this by propping your legs up on several pillows, or you could use a special wedge pillow. So, what's the benefit of elevating your legs? Well, it uses gravity to help drain any excess fluid that is collected in your lower legs and ankles during the day. This fluid then goes back into your bloodstream. This allows your kidneys to process and get rid of it before you go to sleep instead of while you're trying to sleep. For some people, spending even just 20 to 30 minutes with their legs elevated in the evening can make a noticeable difference in reducing those nighttime bathroom trips. Compression therapy. Another physical strategy to consider is compression therapy. This usually involves using compression stockings or socks, and it can help manage edema and, as a result, potentially help with nocturia. These garments apply gentle, graduated pressure to your legs. The pressure is strongest at the ankles and then gradually decreases as it goes up your leg. This pressure helps support your veins and encourages fluid to move back towards your heart, which prevents it from pooling in your lower legs. For people with diabetes, especially those who are prone to edema, wearing compression stockings during the day can be quite helpful. By preventing fluid from building up in your legs while you're active, there's less excess fluid for your body to deal with and get rid of once you lie down at night. It's really important to make sure the stockings fit properly, and your doctor or a specialist can help you with that. Now, when you're using compression stockings, it's important to follow specific guidelines, especially if you have diabetes. Typically, you wear them during the day and take them off before going to bed, unless your healthcare provider tells you otherwise. Also, make sure to regularly check your skin for any signs of irritation, redness, or pressure sores. This is because diabetic neuropathy can reduce sensation, making it harder to notice these kinds of issues. And, as always, consult your doctor before you start compression therapy to make sure it's appropriate for your situation. Number 5. Establish bladder training routines. And that brings us to our fifth and final point, establishing bladder training routines. For some folks, nocturia might not just be about fluid volume or blood sugar. It can also be related to bladder habits and the strength of your pelvic floor muscles. So, implementing bladder training routines and exercises can help improve your bladder's capacity and control, and this could potentially lead to fewer awakenings during the night. Bladder retraining techniques. Let's talk about bladder retraining techniques. Bladder retraining is a type of behavioral therapy. The goal is to help you regain control over your bladder and increase the amount of urine it can comfortably hold. One common technique is to gradually delay urination. So, when you first feel that urge to go, instead of rushing to the bathroom right away, try to hold it for a short period. You might start with just 5 to 10 minutes. Then, over several weeks, you can gradually make this delay longer. The idea behind this method is to gently stretch your bladder and help it get used to holding larger amounts of urine. This, in turn, can reduce how often you need to urinate. Now, this process does take patience and consistency, but many people find that it helps reduce both daytime and nighttime urinary urgency and frequency. It's really about re-educating your bladder, so it sends less urgent signals. Another part of bladder retraining is something called scheduled voiding, or timed voiding. This means you urinate according to a preset schedule. For example, every 2 to 3 hours during the day, whether you feel an immediate urge or not. As you get more comfortable with the schedule, you can slowly increase the time between bathroom visits. This helps create a more predictable pattern and can stop your bladder from becoming overly sensitive. Pelvic floor strengthening. Another important aspect here is strengthening your pelvic floor. The pelvic floor muscles play a really crucial role in supporting your bladder and urethra, and they're essential for urinary control. For people with diabetes, especially if there's any nerve damage or neuropathy, these muscles can sometimes become weaker. This can contribute to bladder issues like urgency and incontinence, which can show up as nocturia. Kegel exercises are specifically designed to strengthen these vital pelvic floor muscles. To do Kegels, you first need to find the right muscles. These are the muscles you would use if you were trying to stop the flow of urine midstream. Once you've identified them, the exercise involves contracting these muscles, holding that contraction for a few seconds, and then relaxing them. Make sure you're not tensing your stomach, thigh, or buttock muscles, and remember to keep breathing normally. A progressive training schedule is often recommended for pelvic floor exercises. You could start with just a few repetitions of short holds, say for 3 to 5 seconds, a few times a day. Then, as your muscles get stronger, you can gradually increase how long you hold the contraction, the number of repetitions, and how many sets you do. For guidance that's tailored to you, especially if you're not sure about the technique or if you have significant bladder concerns, it can be really beneficial to consult a physical therapist who specializes in pelvic floor health. So, to wrap things up, while it can be challenging to completely prevent nocturia, These 5 strategies we've discussed: managing your fluids, controlling your blood sugar, timing your medications properly, using physical techniques, and doing bladder training, can truly make a real difference. When you combine diligent diabetes care with these steps, it can lead to fewer nighttime disruptions and ultimately a better quality of life for you. We really hope these strategies help you find some relief. We'd love for you to share your experiences or any other tips you might have in the comments below. And if you're interested in more information on managing diabetes, you might want to consider subscribing. Most importantly, always discuss these approaches with your healthcare provider. They can help tailor them to your specific needs and make sure they're the right fit for you.